For those who still feel the pull of a night out, restrictions are growing across the country.
Trying to get out at least a few more days and go to restaurants, but frustrating.
Ontario, the latest province to reintroduce a 50% capacity limit on pubs and restaurants as a way to stem the spread of Omicron. Premier Doug Ford changing course 2 days after refusing to impose those measures.
The decision to limit people's ability to gather, especially during holidays, is an extremely difficult one to make.
The province is reporting more than 3,000 new infections. That's triple the daily tally from 10 days ago. The explosive growth here providing a glimpse for others of what's to come.
The road ahead of us over the next few weeks is going to be very rough.
From coast to coast,
it's absolutely frustrating to be here again.
The same warnings.
This is, of course, not where we want to be.
BC is cutting crowd sizes by half in big arenas and concert halls and calling for New Year's Eve parties to be canceled. While for the holidays in Manitoba, families will only be allowed to welcome 10 vaccinated guests, even fewer if anyone is not vaccinated.
The speed, but also the amplitude of difference between where we were a week or two ago here and where we are now, it's shocking.
Quebecers are again lining up for drive-through PCR tests as the province sets a new record for case counts in a single day. This Montreal Children's Hospital announced a baby, born healthy and not even 2 months old, has died after falling ill with COVID. A heart-wrenching reminder of an unpredictable threat.
It's not just the case numbers that have gone up, but we have seen an increase in the hospitalizations as well, and that's really what's most concerning.
Kingston, Ontario is already facing a crisis, with critical care beds in hospital nearing capacity, and the area reporting the highest case rates ever seen in the country. Omicron is bound to only make things worse.
We are anticipating and wondering when we'll start to potentially see those cases through our ICU.
Air ambulances are being called in to move patients to other regions for care, while hospital staff elsewhere fear.
It's very concerning, and people and we get worried about what there is to come.
And Thomas, on this Friday night, in Toronto at least, you may be seeing signs of this heightened concerns about Omicron.
Certainly here on the streets downtown, Ian, it's pretty quiet. I say that on a Friday night, just before the holidays, when normally a lot of people would want to go out and have a drink or dinner with friends. I would also point out that there's a small number of restaurant owners in this city, at least, who've said we're going to pause indoor dining for the time being, knowing that with those projections of numbers of Omicron cases coming, they figure they're going to be forced to go to takeout only soon in any case. Ian.
All right. Thomas, thank you.
You're welcome.
The spread of Omicron is unlike anything seen in the pandemic so far. According to recent data from Ontario, Omicron has a reproduction rate, or R value, ranging from 3 to 4. That means, on average, an infected person is spreading it to up to 4 others, who each will transmit it to 4 others, and so on. National modeling presented a week ago suggests Omicron could drive daily new cases above 26,000 by mid-January. That is triple the record set in the spring. Under this scenario, even if the rate of severe disease is lower with Omicron, a smaller percentage of such a large number could still overwhelm hospitals. Let's bring in infectious disease specialist Dr. Isaac Bogosh. And Dr. Bogosh, at this point, what do we know about the link between Omicron and hospitalizations?
Unfortunately, we don't know enough. We still know that it's extremely transmissible. We know that people, of course, can get sick with this. There's South African data, there's emerging data from the UK and from Denmark. We'll obviously have our own data, unfortunately, emerging from Canada. I think it's still too soon to have a definitive link. I think what's clear is that 2 doses of a vaccine will still provide protection against severe illness. 3 doses will provide greater protection, but it's not entirely clear what that link is just yet.
Which leads us to the next question, which is, I heard so many people until recently calling this pandemic one of the unvaccinated. What about now?
It's a pandemic of everybody. It always has been a pandemic of everybody. By definition, a pandemic impacts the entire world. Now, it, of course, impacts unvaccinated people significantly more than it impacts vaccinated individuals. But still, I think it's fair to say that we're all feeling the health, social, economic, political existential ramifications of this pandemic, vaccinated or not.
We have more questions and answers from you and two colleagues later in the show, so stand by. Thanks, Dr. Bogosh.
My pleasure.